There is a program that pays for medical care, dental, transportation, meals, and home care, all through one team for free or very low cost for many seniors. And most people don't find out about this until it's far too late. So I want you to write this down because it's not a matter of if someone in your life will need this, it's a matter of when. This program is called PACE, Program of All-Inclusive Care for the Elderly. This is one of the most highly recommended programs out there, but for some reason, the people who need it the most are usually the last ones to hear about it. So today we are going to fix that. We're going to cover everything you need to know about what this is, who qualifies, and most importantly, how you can apply. So what actually is this thing? Most healthcare in this country is piecemeal. One doctor for this, a specialist for that, a separate agency for rides, another for meals, and you or your family are the ones stuck trying to piece it all together. PACE flips that completely around. It's one team, your doctors, nurses, social workers, therapists, transportation, meals, all under one system, all talking to each other instead of coordinating through you and working on your behalf so that you don't have to figure it all out yourself. PACE can cover all sorts of things: primary care, specialty care, prescription medications, dentistry, mental health, counseling, hospital and emergency care, lab work and imaging, physical and occupational therapy, nutrition counseling, social services, personal care, home care, and more. They even help you get to the PACE Center and medical appointments. It is an amazing program that we have heard so much good about. In fact, many programs even operate adult day health centers where participants can receive care, eat meals, take part in activities, and spend time with other people too. So if a participant needs hospital care, nursing home care, respite care, or end-of-life care, PACE can coordinate those services in a lot of cases too. The exact care is based on what the PACE team determines is necessary for you individually. It is not simply a one-size-fits-all list of benefits. So here is why it actually works this way, and I think this is important to understand. The idea is that PACE gets paid a fixed amount per person per month by the Medicare and Medicaid organizations. So instead of billing piece by piece for every visit and service that you receive, the program gets a flat rate, and they only come out ahead if they keep you healthy and living safely at home. So every incentive lines up in your favor. You end up with fewer ER visits, fewer hospital stays, fewer crises. And that's not just good for you, it's good for them too. Now, when a lot of people hear that, they worry that it means services are going to get cut to save money. And that's not really the case here. And we have a beautiful story that illustrates why that is. So Dr. Anthony Rizza, medical director of Element Care in Massachusetts, recently told the story of a patient who had COPD. Every summer, without fail, his flare-ups would get worse, and he'd have 4 or 5 major episodes. But in the winter, it always calmed down. Since his condition clearly worsened with heat, the PACE program got him an air conditioner. It helped him be more comfortable, it helped reduce those episodes, and it helped save the program money on his care. So everybody won. Now, these are the same sort of common sense basic needs support solutions that we used to see in the Medicaid demonstration programs. But of course, unfortunately, new policies were enacted that ended those. I am glad to see that some of these supports still live on through the PACE program though, and I would encourage you to check them out if you are eligible for this. So according to Dr. Rizza, once someone is enrolled in this program, the program is committed to doing the right thing for them from the moment that they enroll till the last breath that they take. Dr. Rizza says, we will do everything we can to keep them in the home, including sometimes having 24-hour services in the home, end quote. That is an amazing promise and opportunity. Now, I realize that this sounds like honestly an absolute dream, especially since it has the unbeatable price of being free for those of you who are Medicaid eligible. I know a few years ago, we had a health scare in my family with some loved ones of mine, and we started looking into different solutions, including assisted living, nursing homes, that sort of thing. And I could not believe how much that kind of care costs. We were quoted $7,000 a month or more for this tiny little room in an awful little facility on the edge of town, and it was absolutely astounding that that was the most affordable option out there. So honestly, PACE can be an absolute miracle for those who qualify. On that note, let's talk about who qualifies and how you can apply. Okay, this is where we start getting into the not so great news because this program is a bit limited. But I want you guys to take note of this because if you don't meet the requirements now, you may in the future, and other people you know may need this as well. So, first, you must be at least 55 years old. Second, you must be eligible for nursing home care, according to your state's Medicaid agency's definition. Now, this typically means that you need regular supervision or hands-on assistance with one or more of those activities of daily living, like bathing, dressing, eating, walking, transferring, things like that. You may also qualify if you're dealing with severe memory loss or cognitive impairment. And third, you must be able to live safely in your community with PACE support. Okay. Fourth, you need to live in an area with a PACE program. And this is one that really surprised me because I did not know that not every state did this. Apparently, PACE exists in 33 states and Washington, D.C., but some states don't have PACE programs yet. And some states that do have PACE programs limit them to people in certain zip codes or other geographic locations. You can see if there's a program near you at the National PACE Association website at npaonline.org. That's the official list of 4 things that you need to qualify, but there's kind of an unspoken 5th requirement that most people don't mention, and that is that once you commit to PACE, you have to receive all of your Medicaid and Medicare funded services through the PACE program. If you go outside of the PACE program, if you get say a Medicare prescription plan that's outside of PACE, you will often be disenrolled from the PACE program, which is okay. You're welcome to leave every time, but you need to know going into it that you can't have PACE and other services. It's kind of an all or nothing deal, it looks like. And I guess that brings us to one more myth, because contrary to popular belief, you do not strictly have to be Medicare or Medicaid eligible in order to participate in PACE, but it definitely helps. You can be dual eligible, you can be eligible for one or the other, or eligible for none at all. If you receive Medicaid, then you could pay nothing at all for PACE's long-term care and support benefits. If you receive Medicare but not Medicaid, you will often be expected to pay a premium or a cost share for some of those services, depending on your situation. You'll generally be expected to pay monthly premiums to cover part of those services, and those details can vary. But if you don't have Medicare or Medicaid, you can sometimes still participate in PACE, but you have to pay cash for it. And the National Council on Aging says that that will typically run $4,000 to $5,000 a month on average. So do be aware of that if that's something that you want to explore. Now, the question, of course, is how do you apply? So if you're interested in applying for PACE, the enrollment process depends on where you live. You can start by finding your program on that National PACE organization website at npaonline.org. Look at the map, select your state, look for the programs that are available in your state, follow those links for application instructions, eligibility requirements, so on and so forth. And then once you start that process, you'll generally go through an intake screening where PACE will meet with you and your caregivers if you have them. They'll evaluate your specific health situation and needs and determine if you are eligible. They'll even put together a personalized care plan for you and help you figure out exactly how it works. And like I said, remember you can leave the PACE program at any time. And if you're ever denied enrollment into PACE, they have to give you a written reason why and suggest other options for your care as well. Now, circling back to where we started, it is not a matter of if someone in your life will need this. It's a matter of when. Maybe that's a parent who's starting to need more help than you can keep up with on your own. Maybe it's a spouse. Maybe one day it's even you. And the honest truth is that most people don't find out about PACE on their own. They find out about it from a friend or from someone who learned about it and is sharing that information with them, maybe through a video like this one. Usually right when they need it most, but sometimes a little too late to get the full benefits out of it. So we really want to help get this word out. If you know someone who might need help, whether that's a parent, a neighbor, someone at your church, anybody, please send them this video. That's honestly the only reason why programs like this stay hidden is because people don't know where to find them. So if you can help us get the word out about this one, we would really appreciate that. And of course, we'll be back soon with more ways that you can save money and get help. We'll see you there.